Okay, Dr. Royse, thank you for your time. And today we are going to talk about your program evaluation about cancer knowledge improvement and screening awareness in Appalachian area. So would you briefly talk about the objectives and goals of this program evaluation?
This study came about for, I guess, a couple of reasons. Several years ago, in 2005, UK received a grant from the National Institute of Cancer, National Cancer Institute, to start a project that they called the Appalachian Community Cancer Network. And the idea behind that was to reduce cancer disparities. Cancer disparities means not every area in the country is equally served by health providers, health services. And so what you find sometimes in rural areas and sometimes in inner cities and so forth and other places, that there are pockets of, might say, populations of people who don't receive adequate services, or for whatever reason don't have transportation, they don't have insurance, and what happens is, in particular with cancer, is they don't get screened. And screening, we're talking about women getting mammograms, clinical breast exams, pap smears, men being diagnosed with lung cancer, colon cancer, and so that is sometimes called a cancer burden. And the burden just means that the rates there in these pockets of the country and these populations are exceed the national average. And so Appalachia as a region has a much higher incidence of cancer than you would expect to find.
How did you design this study? It seems like you used the experimental design, and why did you choose that model over other models? This
Appalachian Cancer Community Network is composed of 5 states, and they have meetings. And so the researchers and so forth who are associated with the project come together once or twice a year to talk about educational efforts and so forth. So we were driving back from a meeting in Morgantown, West Virginia, and I can't remember the topic that day, but the project is community-based participatory research. So I was just thinking, sitting in the back seat of the car, someone else was driving, how do you get into a community? How do you involve community residents? And how do you do that, particularly if you're in Lexington and the people in need of the intervention are, 150 miles away or something? So it seemed to me that kind of a little light bulb came on, and I thought, well, telephone, cell phones, we can call people, but then what do you do with that? And something that I had been interested in years ago is something that's actually quite timely right now, close to the election, and that is what's called push polls. A push poll is when a surveyor will call someone and under the pretense of asking someone who are they going to vote for, say a Republican or a Democrat, they try to influence the respondent by saying, well, did you know that, for instance, Mitt Romney did such and such, or Obama did such and such? And so it's not a truly objective call. It is designed to push the respondent to vote for the candidate that hired the survey firm. So it's a little bit unethical. But I started thinking, well, could you use a push poll for good? It's kind of like dynamite. You can use it to blow stuff up, or you can use it, I don't know how you use it. Well, you can remove a tree stump or demolish an old house or something, but it's not necessarily for harming people. So I thought maybe we could find a way to use a push poll for good. And I just tossed out the idea to the head of the project as we're driving back from West Virginia, and I said, suppose we called people, we asked them what would be kind of a needs assessment and ask them a series of questions. What did they know about, say, at what age should a man get screened for colon cancer? Or what age should a person, how often should a person have an X-ray of their lungs? And I said, and if someone did not know the correct answer, then we could call them back, say 3 months, 4 months later, ask them the questions again to see if they had learned from our initial interview. But because we want this to be a good study and possibly a scientific study, when we call originally, we'll randomly assign the respondents, some who will get the information and some the correct information if they're wrong, and some, if they give a wrong answer, they just give a wrong answer. So we're not influencing them one way or the other. So in that sense, it was an experimental design. And the reason we chose that design is because we wanted to see if it was in fact the intervention that made a difference and not some other variable in the community, like a church group or something who goes in and has a cancer awareness day and so forth. And by kind of a little footnote here, there are cancer education efforts going on in some of these communities. One year brought in a fellow who dressed up in a, I don't know if it's a latex rubber suit or what, but he was called Polyp Man. All right, a polyp is a growth inside the colon that the doctors actually remove when you have a colonoscopy. So it's kind of a humorous attempt to educate people without being real gory or clinical or anything about it. So there was always the possibility that people could have been educated about some of these notions about when to get cancer screening that had nothing to do with any of our efforts. And so we wanted to see as best we could whether the intervention, which is giving correct answers when people missed it on our questionnaire, if that was going to change anything at all. Because this is going to be a large survey effort, and we're going to involve 700, actually probably closer to 1,200 people, but then you start eliminating people because they're, a teenager answers the phone or something like that, or you call numbers and they don't ever pick up and things like that. We knew we would want it somewhere between 600 and 700 respondents, and that would give us, in this article, it gave us a 3.7% margin of error. So we knew what we had and what the range of true responses were and so forth. 700 respondents is more than any one researcher could do easily and quickly. So we hired the Survey Research Center here at the University of Kentucky, and they are a full complete operation. So they reviewed our questions, they made some suggestions, they hired the interviewers, they conducted the phone calls, and they presented the data back. So actually it was fairly painless from our end once we got the questions designed and approved for research. And the project that was funded through this Appalachian Community Cancer Network, they funded it, so it didn't come out of my pocket. So that's the advantage of, I guess, working for a large grant. We did quantitative because it is closer to science, in my opinion, than the qualitative. The qualitative might answer a question like, I was trying to think of an example. If you sent somebody to the doctor and you said, how was that experience? And they said, well, I went to sit down and there was a candy bar wrapper in the seat, a half-eaten bag of potato chips, and I had to sweep those out of my seat before I could sit down. And then I waited 45 minutes before anybody called me to see the doctor, and I went in and there were children crying. It was noisy. I don't think I'd ever go back. That is a very different kind of information than what we were looking for. We wanted to learn about their knowledge of cancer screening on several levels, different types of cancer, and push that kind of as far as we could. So we weren't interested in any real in-depth information, which is what the qualitative approach gives you, kind of all the rich details and but from a much smaller collection of individuals. And it may be that people are not thinking about being an evaluator or seeing that as a role that a social worker could do. But using my own personal experience, I was a evaluator in a mental health system for 7 years, and we had a number of contract agencies, and so the mental health board was very interested in providing good quality services, which I think we did provide, and the evaluator was able to reassure the board and the community, and we published reports. We had quite a transparent operation in terms of reporting numbers of people who were helped and the kinds of just even assessing the needs in the community. And from that, it was fairly easy to walk into other types of administrative positions. And when I left, I was the director of research evaluation and program development. So there were opportunities to do things other than just, you might say, your research or evaluation project. And that kind of interest, I think, has served me well as other agencies have come to me from time to time and asked for help with evaluating some projects. So I guess what I would say to your students is that there are jobs out there. Most large federally funded projects need an evaluator. Even small nonprofit agencies from time to time need to evaluate their services to see if what they're doing is meeting the needs in the community, or maybe they have a sense that a program isn't working and isn't effective, or they want to try a new intervention. So it's a type of a position that is not that difficult to do, actually. It can be very stimulating. You get to contribute to the professional literature, if you're lucky, and find some things out. I found it to be very fulfilling and rewarding. I guess because it's a way of assisting people other than just doing the direct service route. And the good thing is all you have to do is learn your group research designs and learn a little bit about statistics, and you can make yourself invaluable.